What to expect at your scleral lens fitting. So first of all, you should expect to wear a scleral lens at that visit. It helps you, and also helps your doctor determine if it's right for you or not. I've heard this from other places that talk to patients about scleral lenses, and they don't let the patients try them before they start designing and making them. To me, that's a mistake because you don't know whether or not a patient might handle it, and you won't know for yourself if you can handle it as well unless you just try a lens. So a doctor should do this. They should scan the shape of your eye to determine the shape of the white part of the eye called the sclera. From that, they should be able to take a lens that might be somewhat in the ballpark of being close to fitting it well, and they should put it on the eye, and you should be able to feel how a scleral lens feels. It should feel pretty comfortable. You should feel like barely anything is on your eye, or at a scale of 1 to 10 in terms of discomfort, it should be like a 1 out of 10, very, very low. You'll feel a little bit of a cool sensation when you have the scleral lens on. The reason why is because they fill the bowl with saline ahead of time, and you put the lens on afterwards. So by wearing essentially like a liquid bandage, it might feel a little bit cool to the touch on your eye, especially if you're new to wearing contact lenses. How well you see with the trial lenses might be blurry at first. That's okay. The doctor should next do a refraction with a phoropter to find out what the prescription is after they put on a trial lens on your eye. Afterwards, they'll order the lens. You'll pick it up usually in a couple weeks, and then you'll try it on for the first time. If you're new to scleral contact lenses, the office should teach you how to put them in and out. I've heard of other offices that just give you the lenses and expect you to learn how to do it on your own. To me, that's a big mistake because many patients have a really hard time putting the lens in and out unless you spend time with a professional having them help you train how to insert and remove the lenses. You might have problems with the fit, such as excessive bubbling, the lens is leaking, the lens is too tight on your eye. Even when you take it out, it really hurts because you don't have the proper technique. You should have a training on insertion and removal. Sometimes you'll have to tweak the lens design afterwards as well. Usually the first scleral lens for many patients is not perfect. There's some fine tuning that has to happen because it's an art and science to doing this. So know that you usually see a doctor probably up to 3 months to finally finalize that lens design. If it's taking more than that, there's some issues. You're a harder case than usual. It does happen, but usually I would expect to be done within 3 months for your scleral lens fitting.